gender dysphoria is actually a symptom of underlying mental health disorders. What are the actual rates of suicide attempts in a variety of different mental health disorders? Let's just kind of start there for a baseline. So, someone with autism has an 8-time higher likelihood of a suicide attempt. An LGB individual, lesbian, gay, or bisexual individual, it's actually 20 times the normal rate of suicide attempt in the general population. Someone with depression, it's also similar, about 20 times the baseline rate. An individual with anorexia or bulimia has anywhere between an 18 and 30%, or 18 and 30 times rather, higher rate of suicide attempt. And that's just absolutely tragic. And it speaks to the mental health crisis that we have in our culture, and people that we really need to help who are suffering greatly. But what's interesting is that in the transgender population, that rate is 13%. So lower than the 20% or 30% or 18%. So 13% seems to be the best information that we have kind of across the board. So keep that in mind, and just the background of your mind, that underlying mental health disorders increase the rate of suicide attempts significantly. But transgenderism actually comes in underneath a lot of other diagnoses. Now, the fact that so many people are suffering through this should really give us pause, especially as Christians, help us to just understand the compassion and sensitivity of this type of topic, okay? So keep that in mind as well. So, what's some of the other literature? So, in terms of underlying mental health issues, so the Tavistock Clinic in the UK, it's a transgender clinic, mental health clinic that has dealt with this over the years. They published a study. What they demonstrated was that about 2/3 of the kids that are presenting to them in the gender clinic had very significant, severe underlying mental health diagnoses and or autism spectrum disorders. And that's before they developed gender dysphoria. Okay, so that's in the background. And also what's interesting is that about 75% of all of those patients coming into the clinic were girls. So there's this kind of skewed population according to gender, where girls are more prone to this. So those are interesting thoughts that we have to keep in mind and ask ourselves, well, why is that? What are some of the other contributing factors that might be involved? Now, here's something I really want you to hear and let this sink in for a minute. And I think that speaks to the fact that gender dysphoria is actually a symptom of underlying mental health disorders. It's not the cause of future mental health disorders that might lead you specifically because of that towards a suicide attempt. There's a lot going on with the individual underlying all of that that's really, really important to know. And there's a study I'll get to a little bit later on that says if you follow people out after a puberty blocker, hormone therapy, or surgical transition, if you follow them out over time to about the 10-year mark, you'll actually see that their suicide attempt, the rate, is about 19 times the general population. So to me, what that means is the actual transition itself didn't work. It wasn't effective, right? There might be some initial relief of treating the dysphoria itself as a symptom of this individual's distress, but over time, the treatment in gender affirming care is actually harmful and not effective.